You also looked at them from a great length. But today or right now, I would like to take another perspective, looking at health policies. So health policy, obviously, or defined dictionary-wise, defined as decisions, plans, and actions that are taken to achieve specific healthcare goals within a country, within a society, within a community. So we do have different health policies. Could be macro, could be global, could be regional, could be a country, could be a community. And in our setting, it could be even a county government kind of a health policy. But in all the health policies, what's important for us to understand is that the health sector, as it is, it's often an object of political bargaining. And you would agree with me in our situation in Kenya, politics and elections have a lot of power in the way that health sector is governed. Sometimes it might look like the health sector is just a technical department, but so to speak, it's influenced through political bargaining. For example, the way positions of power are located based on, you want to make it power balanced in terms of you have all the tribes taken care of in Kenya. So it has a political bargaining, or it has a political effect to it. And therefore, within the overall health sector, policies are affected by political reasons and political influence on the policies that we have. So as we have said, some policies could be looking at major issues or major concerns in the health sector, but some of them could be microscopic, looking at a certain issue, for example, the control of a communicable disease or drug control. It's possible. So macro policies that have far-reaching implications, they tend to have a robust political character, even when we're advocating for that. A good example in Kenya is the Big Four agenda, where we have UHC, Universal Health Coverage, as one of the Big Four agenda of the current government that we have. So to speak, because it's a political agenda of the current government or the current sitting president, so there has to be policies that are made and that will be affected, obviously, from a political sense of view. So we'll look a bit more into the UHC, that's the Universal Health Coverage. We'll look at primary healthcare as health policies that at the end of the day affect our lives, because when we go to the facilities or to the hospitals, or when we have a relative who is going to the hospital, there's certain expectations, especially because we are defining UHC as the ability to go to a health facility and get all the care that you need, healthcare that you need, without incurring a financial strain. As much as that is within the policy that you should go and get all the services you need without putting you into a strain, economic strain, or pushing you further into poverty, we will look at how that is in policy, but what is the experience on the ground? Do you find what is in the policy, does it translate to the service delivery at facility level or a health care facility level? To continue on with the health policies, we're saying that the health policies obviously have to a large extent, affect the way services are delivered, and they also affect the allocation of resources. And if we are not careful when we are coming up with health policies and not involving the relevant other authorities or other departments that deal with, for example, financing for health policies, we may end up with policies that are not funded or that do not have an allocation to them. Therefore, they remain as policies, but cannot be implemented, because every implementation of every policy will require resources. Policies are not static, they evolve over time. One year ago, we did not have COVID-19. Now we have COVID-19. We did not have COVID-19 in our policies. So I believe that all the countries here in Africa, in Kenya, worldwide, have developed policies around COVID-19, how to mitigate COVID-19, the treatment. We have seen a lot of development in terms of research to get a COVID-19 vaccine. So policies evolve over time. Some could be due to emergency measures like COVID-19, and some could be just it's time for the countries to do their health policies. Mostly health policies would be 3 years to 5 years, but there could be emergencies, maybe an outbreak of a disease that require that countries look at their policies. Another way of getting your policies updated if there's a major breakthrough in terms of research. So if there is a new drug, perhaps there has been research that has been ongoing, and you have a drug from that research, or you have a product coming out of research, is also an ideal time when policies are developed either for that product, or policies are updated to include that new product that has come from science. So just looking at some of the instances where we are making policies and how policies are made or governed. Policy documents therefore becomes a reference available to the actors within the health sector, and it affects the way service delivery is done, because in the absence of a policy, there will be no financing, there will be no provision for the products or the services or the policy, whatever policy change that you want to see. If there are no policies to govern how that is implemented, then it becomes a challenge. Sometimes policies are developed or conceived from a genuine motivation. For example, maybe updating a new drug or correcting some flaws or to improve a certain situation. However, the motives behind the formulation of policies sometimes are not necessarily related to the stated desired effects. Policy making can take a long time, so sometimes it brings fatigue. Sometimes, and that could be to gain a political recognition. Sometimes you could be making policy because you want to lobby for a certain service, for a certain product, or sometimes, as we have seen, perhaps I could use in the Kenyan context, perhaps in a strategy formulation, so that you can seek a job position or creation of job positions. So it's so to speak that as advocates, as young people, as people who are really interested to see that the communities get the services that they deserve, health services that they deserve. And why we as advocates engage is because some of these policies could be made, but with another intention. So our role as advocates is to ensure that the policies that are being developed are developed for the good of the common person, what we call Wanjiko, or we call the Mwananchi, ensuring that it's for the good of the community and not intended for other things. So within the Ministry of Health, we are still talking about health policies. Within the Ministry of Health, usually is always almost not the biggest priority for the government, because there are so many other competing priorities. We have the finance department, we have defense, we have foreign affairs, we have the industries. We have so many other departments that the government prioritizes. Health is always almost not among the top priorities when you look at the way the government governance is done. So therefore, you need, as advocates, to always be present, to always ensure that health has become prioritized, health has been funded. Sometimes you'd see that there's allocation for money, and when there's an emergency or when there's something that is coming up, you see that the money is drawn from health sector into taking care of security or taking care of defense or other causes. So our role as advocates is to always ensure that health remains a priority of the government. And sometimes it sounds so easy to say that, but sometimes it's not as easy as said for that. And within, like in our Kenyan setting, there is within the Treasury, there is somebody who is placed there within Treasury who represents health when they're doing the budget making process and negotiating for the budgeting and how to allocate resources for health. So if you don't have someone who is very aggressive within the Treasury or within how budgets are made, you find that health will have a least allocation, and therefore all the policies, health policies that are being done and are not being linked to financing and to allocation, it means most likely those will not get implemented. So, and therefore, health policy making becomes just another way of looking good, that we have a lot of policies, but it is not that we are improving or that we are not doing well. So a classic example for Kenya, I would say, is that we are not short of policies, health policies. We do have so many policies about health in all the sectors, around everything, around HIV, around sexual reproductive health, around TB, around anything, you can name it. But the challenge is the implementation of those policies. Sometimes they fall short of implementation. They get dust on the shelf. They're not being helpful to the common person or common wananchi. So our role as advocates is to ensure that when policies are done, they are implemented, and accountability for the same. If the policies are being implemented, accountability, what is the result? What is the impact? How has that changed the community that the policies were meant to do? So within the Ministry of Health, of course, we also have smaller units that are also making policies. So we could have a HIV department that's making policy. We could have a family planning department that's making policy. We could have sexual reproductive health and other services, TB, for example, prevention and treatment. So how these small policies interact with one another also affects in a large way to how services are delivered at the community level. And I've said there, for example, a classic example in Kenya, we have been advocating for integration of services, that when you're doing all the services you're offering at the outpatient level, you should do an integration kind of services such that somebody walks into the health facility, they are able to get all the health needs, all the services that they require under that one visit. But sometimes because the policies are so broken and our levels of funding are also broken, they are what we call what you call vertical kind of funding or kind of classifying health. So you find that that's not working in an integrated way because the health policies are not integrated in themselves. So to speak, as advocates, what we advocate is that we need to have an integration of health services. And with the UHC agenda, this is a real opportunity where all services can be offered to a person walking into a facility. So to speak, we don't look at people with the condition that they present with, but we look at them as holistic, and all their health care needs are taken care of during a hospital visit, in one visit, under one same room. So I want to stop there on the health policies and see whether there is any questions. But the main point here to note is that it's very important for us to engage in health policy making, because if we are not there, then some of the interests of the community may be left out. So as advocates, your voices for the community, you're influencing how policies are done, you're influencing how the formulation takes place to ensure that at the end of the day, the community is well taken care of. The voices of the community are represented, and that when it comes to implementation, there will be impact at the community level. So I want to pause there and see whether there are questions. If there are no questions, then we can proceed. Cheryl, you can help me. Are there questions?
In the chat box, there are no questions, but
Okay.
I've always had a question. Is there a
Yeah.
place where I can go say, the way there's a constitution, is there a place that all policies are written down?
I would say yes and no, because, and it's a major challenge. So one of the biggest challenge that we face in our day-to-day work is access to information. Ideally, the government should upload all the policies to the Ministry of Health website, but it's not always so. It is not always done. It is not always so, but I would give credit to say that if you went to the Ministry of Health website, you can find most of these policies, maybe not to 100%. And also that's speaking about Kenya, but globally as well, some information, access to information and data and reports is not always available in our work that we do, trying to influence the policy. So, and that puts you at a really awkward situation when you need to make a policy intervention but cannot be able to access policy documents. And sometimes, for example, some of these documents could be a budget, and the budgets are voluminous and they are written in an economist kind of language. So as advocates, when you have to do a budget intervention or a budget advocacy, it becomes real difficult because you're not able to read a 200-page document that's talking about a budget breakdown, and you are also some of the language that is put there is always a technical language. Therefore, it becomes difficult. You have to work with an economist for you to make out what the information is. So in general, access to information, access to data, access to policy documents has been a challenge, and it's something that as advocates, we are always calling the government and other policymakers, including donors, to make information accessible and available. But I would say governments it's really hard sometimes to get all the information you need in one place, which makes it hard. And also to add on to that, I would say in all the policy making and formulation, there has to be a transparent process where different stakeholders are engaged. And sometimes that engagement, the advocates, civil society, and communities are not well engaged enough. For example, you will see a call to a public participation event around a policy or around a budget that comes a day before and comes with a 200-page document. So you're not able in one day to read a 200-page document, interpret what that means, and be able to go to a meeting and make interventions or make informed interventions. So one of our greatest call, and for you as young people, I would challenge you that we need to call for government to be more transparent in sharing information, because with the information, you are able to make an intervention for your community. Thank you. Just checking whether there is any other question.
No, thank you for answering mine. And if anyone has a question, you can just ask in the chat box or unmute yourself. Also, if you don't mind, you can also start your video so we can see you and interact better. There's a question in the chat box.
Great. Yeah.
From Zakaria Suleiman. Globally, we may witness some differences in health policy. So it makes global health policies to be implemented easily for some countries and not for others.
I'm trying to see how I go to the chat.
There is a chat button down there. No, you don't need to stop sharing.
Okay. Sorry, I've seen it. Globally, we may witness some differences in health policy. So what makes global health policies to be implemented easily for some countries and not for others? Yes, a very good question. Thank you so much, Suleiman, for asking this question. So it all goes to transparency, what I was saying. Some countries or some agencies are more transparent than others. And I will give you a classic example. There is a project that's being implemented in Kenya. It's called the Global Financing Facility, GFF. It's a maternal health project for every woman, every child, and every adolescent, like preventing deaths or improving health outcomes for mothers, for children, and for adolescents. And one of these projects is one we learned in a global setting, in a global platform. And so when we came home, we had to find out what the government is doing around this, and actually realized that the process had been done, the document strategies had been done, but the advocates were, I would say, not meaningfully engaged at that point. But as soon as we started asking questions, as soon as we started asking where are the policies, how much money has Kenya received, we were able to get that information and plug in to the process. But as long as you don't know the information, as long as the information is not out there, it's very difficult for you to engage. And so information sharing is a really difficult process when you are in a civic space and you want to make an intervention. So, and continually, some of the information, you would get it from World Bank, for example. You will see a Kenyan strategy from a World Bank website, but you will not find it within the Ministry of Health website. So you can find information about your country at the global level, but you will not find it at home. So some of these things makes it very difficult for advocates, especially grassroots advocates based in county, if they have no relations or they are not interacting with a global level advocacy. It becomes, if there's no linkage, it becomes very problematic for advocates to engage. So I would say transparency. I would say even the way the policies are financed, because one of the major hindrance for implementation is finance. So when the policy is being developed, there has to be a plan for how it's going to be financed and how it's going to be implemented. So financing, transparency, the availability of information and data, and also just having the plans and involvement of the relevant stakeholders, ensuring that all the stakeholders are on the table. So I don't see any other question. I hope I have answered you. I see another question that just came in. Creating health policies, what guidelines can be used as a framework to ensure that our policies can be well received and more likely to be passed through? So we are going to come to this. You're running ahead of me, so just hold on to this question, because if I answer you, then there's an exercise that's coming that will be touching on that. So allow me not to answer this question now, but we can talk about it in the exercise or during the exercise. So in the interest of time, I think we can move to the next discussion. So we will go into, well, we will not go into group for this one in the interest of time. But what I want you to do, or I'm requesting you to do, is to go on your chat right now. And I would like at least some 5-6 people to give me a response on the first question. So if not all of you, perhaps if I could get some answers on the first question. On the first question, who are the most critical policy stakeholders in policy formulation? I would like to see some answers on the chat box, kindly. If there are no questions, then we put someone on the spot. Who do you think the relevant and most critical policy stakeholders? Government, exactly. I've seen government, yes. I'm seeing your chats coming. Thank you, Simon, Humphrey, Oyeho for that. So it's government. There must be more than government. Suleiman, thank you. Government again. Yes, the community. Community is a different stakeholder, very, very, very relevant. There's private sector. Thank you. So thank you, because I have company here on the chat. Please continue to chat, continue to chat. Financial sector, yes, financial sector, or the finance department, treasury, you may call it. So we have the government, we have community, private sector, finance sector. We must have more than that. Do we have any other answer? Anybody with a different answer on the chat? Comment quickly on the chat before we proceed to the next question. Okay, great. Yes, NGOs. I've seen NGOs. We have different types of NGOs. We have the international NGOs. We have the local NGOs or national NGOs. We do have community-based NGOs. All those are very critical, and they represent communities. So very, very critical stakeholder to be engaged in policy formulation. So thank you for those questions. We will soon look at the stakeholders and see whether we have left someone out. So in very, very briefly, why do you think the stakeholders you have chosen are very important? Why do you think the stakeholders are very, very important? So quickly go to chat and write a response. I'm still waiting. I'm here on the chat. I am waiting. We have said there's government, there's NGO, there is financial sector, there's private sector. Why is this important? Government implement policies, Treasury can ensure policies are viable and can be acted upon. That's correct. Ohio, yes, the government actually is still the one that implements the policies, but with support from different stakeholders. The NGOs also do help in the implementation of the policies. And there are other stakeholders, again, even communities, an enabler for the policies to be implemented. They have been entrusted on policy making. That's the government. The government have been entrusted on policy making. Yes, that's correct, but we need other stakeholders to hold the government accountable, because imagine a situation where the government is formulating the process, the policies, and they are still the ones implementing. So who holds government accountable for implementation? A good question. Who holds government accountable for implementation? I'm seeing a response here. Government is important because they are the major sources of funds. Yes, very true that government is important because they fund some of the projects. I don't know whether to say it's true, but there is also another element of, government over-reliance on external sources of funding and not necessarily funding health in domestic from our own taxes as a country. So we do need the government to finance domestic resources towards health. And I can tell you our vaccines program, the vaccines for children, they are almost 90% externally funded. Well, except for, the infrastructure, the human resource and all that. But if we're having around 90% of our vaccines being externally funded, I'm talking to the response around that the government is a major source of our funds. It's true, but we need the government to allocate domestic, because some of the areas, like TB, HIV, and malaria are also heavily externally funded, meaning that government is not the sole source of financing. And we'll look at that later on. The government needs to collaborate with other stakeholders. That's true. So we need everybody to be engaged during policy making. The community must be able to need the policies themselves. The policy helps them. Yes, so the government is an implementer, major stakeholder for the policies that they make and they implement those. Therefore, the government needs, it's a major stakeholder, but it needs work in collaboration with other stakeholders. Government is held accountable by international agencies or stakeholders. That's very true. But before also we go to international agencies to hold our government account, we as community, I am challenging you as young people that you need to plug in holding government accountable, in implementing policies. You're the future leaders of this country. You're the future in this nation. So we do need your voices in holding the government accountable for implementation of the policies. For example, when COVID-19, we had first cases of COVID-19, we saw a quick turnaround of government making policies, creating measures and standards of how we should operate, and even bringing the COVID-19 restrictions and all that. But we also know that we are not able to account for a specific amount of money that was for COVID-19. But yet we are not talking about this. We are not holding the government to account to actually give us reports of the implementation of the COVID-19 pandemic. So in holding the government accountable, that one, as the youth, young people, we continue to call you out in holding government account. The government, because it's given the trust to implement those policies. Yes, we have given the government the trust, but beyond the trust, they must be also accountable. And the government is accountable to citizens, its own citizens. NGOs can provide an outside view on the policies we have if they are working, and can provide unbiased opinion, yes. So NGOs represent community and community voices. So it's a major and a critical player when it comes to policy formulation. The community stipulates the need for policy making and holds the other stakeholders to account. Yes, all the policies that we are making them for someone. We are making them for the community. And therefore, community becomes very integral in the process of making the policies. So I'll stop there. We can continue with this conversation. Thank you so much for that. I can see that we are very much engaged, which I really love, all your responses. And I hope, Cheryl, you can take all these responses we have on the chat and put them together, and we can fill in some of the answers and fill in some of the comments on those answers, just to make this conversation rich after this workshop. So moving on, this is a More Kenya of some sort, whether we included everybody. And I can see we did not include everybody. I don't know if this is disturbing you to see. I can see that we did not include everybody. For example, when you're making health policies, you need your health workers. I did not see health workers on the chat, but remember, health workers are the ones to implement. If, for example, is an immunization kind of policy that you're making, or primary healthcare, it's the healthcare workers that are actually going to implement this. So to what extent were they involved? In our country, in Kenya, we have a devolved system of governance. So to what extent are you involving the county governments? Because they are also very integral in implementing this in implementing the policy. So you have to bring the Council of Governors that covers all the county governments. We have technical experts in an area. Maybe if you're looking at a maternal health, child health, you need an obstetrician, a gynecologist. If it's something that requires financing, you'll need an economist who comes and brings to your policy the economics part of it and how it's going to be implemented. We've talked about civil society advocates, communities, the donors, the funders. I think that one you did not say. We have other government sectors. And by other government sectors, I mean that if you are, for example, advocating for or doing a policy around nutrition, you need the water sector or water and sanitation sector, because you need the food and whatever to have enough water for sanitation and all that. So if you're a health you're coming up with a health policy, but you're not integrating other sectors. For example, the agriculture sector, the water and sanitation, those have an effect or have a direct effect to what extent your policy can be implemented. So there needs to be an integration of sectors within government to ensure one thing is done. And I can give you a good example that where we struggle a lot in here under child health. When we are looking at nutrition, and we're looking at children. So there is a school feeding program that goes to the Ministry of Education. There is the nutrition department that sometimes is lost between the Ministry of Education and the Ministry of Health. So you can have and you can find initiatives that the Ministry of Health comes with, maybe hand washing in school. Next week, you'll find the Ministry of Sanitation and something coming with the same hand washing, and they have different kind of funding and budgets for that. But there's no collaboration within the sectors, yet you're doing the same thing. So the same in health. For children to be healthy and nutrition, you get a kind of feeding program for the school. And then the nutrition sector also is planning for feeding so that children are not malnourished and they get a meal at school. So you go and collide. The Ministry of Health coming with food, they're looking at, the growth indicators, they're fighting malnutrition and all that. So is the other sectors for the same intervention. So as when you're doing policy, there has to be a lot of integration, which unfortunately is not happening. That one I can tell you, there needs to be more work that's happening. We need the private sector. The private sector often comes with, they bring technology. You can imagine partnering for a health policy implementation with Safaricom. They'll bring their messaging, they'll bring their technology, they'll bring all that. So very critical. Sometimes they'll bring funding with it. Very critical to have private sector engaged as well. We have the UN agencies, we have the World Bank, USAID, UNFPA, all that, World Food Program. We have academia, the professors who might be the technical experts, but very, very critical to be engaged. And the other very, very critical stakeholder is the media, because during formulation of policies, you have to have media. Media helps with transparency, helps with ensuring that the public or the community is aware of what is happening. If people are not aware of what is happening, they will not plug in. But media comes in to bring the information to the open, which I think media must be involved, should be involved from the beginning of formulation of the policies all the way to implementation. It helps, media helps with the social accountability. I see a hand raised up, and why don't you ask your question at this point? Thank you. I'm waiting for the question. You can unmute and ask the question. Yeah.
It's Ayao. When you mentioned about the private sector.
Yes.
When the private sector usually they come and join the private sector when they come into making or joining our policy.
Yeah.
Most of them usually come with certain conditions.
That's true.
And these conditions are saying may lead to slightly altering of our initial thoughts and our initial goals with our policies.
Yeah. And
You understand? Because
yes, I have understood your question. Thank you. Your line is not so clear though, but I understand
yeah,
the question. Yeah, great. So I understand the question. The question is private sector engagement. So private sector engagement, to be honest, is it needs to be handled it needs to be handled well, because as you're saying, and it's true that the private sector can come and twist your policy to something that favors them, because they're in business and they want what is in them for what is in this for them. Like for them, there's a way they see how things should run, and they're thinking from an economic point of view perspective. What is the return on this investment? If they are going to fund your policy, what is the return on investment? That's the language of the private sector. But not to say that they're not important, because not always will they change the original intent of the policy, of the project, or whatever it is that you're planning. So because of coming with that perspective from a business perspective, so it is great if by the time you're inviting stakeholders as government or as the people who are coming with this policy, you define what is it that you want. So if it's a problem, maybe right now we have a challenge in Kenya, which is increasing unacceptably increasing rates of new HIV infections among young people. There's some noise on the line. Yeah. So we are in a real challenging time, because we are having increasingly unacceptable high rates of new HIV infections among teenage girls, adolescents, and young women. So we are formulating a policy right now. So we need to have all these stakeholders together to discuss that challenge and how that problem can be overcome. So as long as you have defined what is a problem, what is a challenge, and what we want to do, and then you're bringing the private sector, perhaps they could come in with messaging around, how young girls should protect themselves from getting new HIV infections. So in that sense, perhaps they'll get the visibility of the messaging that's going out. But we get your point, but not to say that we should keep one stakeholder out. Is just ensuring that the stakeholder on the table is obliged to the intent of the policy by supporting the policy to be implemented, and in a way that it will have an impact within the community. The rest of the things then becomes irrelevant. So, and that is why you need especially the communities to sit there, because communities will speak for communities, but perhaps a private sector person may speak for business or may speak to colleagues in business. So you must ensure that the communities are there and they define how they want the services to be delivered to them, because they are the recipients. So as long as you have enough voices for the cause that you're creating a policy for, then you're likely to achieve it. But if you have, for example, the government and private sector and the UN agencies and academia sitting down to develop a community policy, then it may not go well, because the community is absent, or community needs to say, we want to be reached this way, we want our services to be delivered this way, because one way of failing is by not involving the beneficiaries who are the communities. So over and over, I cannot overemphasize the need for community when policies are being formulated. I hope it's clear now. What about mentioning religion as a stakeholder? More people are likely to object policies? Yes. Apologies that I didn't bring there's a CBO, I think I put all of them under civil society, advocates, communities. there is a faith community or the faith-based organization. As community-based organization, there's faith-based organization. So there are representatives from the different religious groups that should be engaged when you're doing, thank you for that. I had forgotten to include the religious representation during formulation of policies, because we know that there are some religions, for example, that don't allow people to go to hospital. So if you're not engaging with them and you're planning for a community that the religion is prominent, or that religious organization works in, it means as long as you're not engaging them, you may not be able to overcome that challenge. Another thing is including family planning, including HIV prevention. I think the religious community, stakeholders, and leaders must always be part of the people that you you engage. Thank you so much for reminding me about the religious sector. I'm sorry I had omitted that. So at this point, because of time, I'm checking. How are we doing on time, Cheryl?
We are doing well, I guess.
Huh?
We have
So do we take a 5 minutes break or do we continue?
I think that's up to the audience.
I'm suggesting that we continue because we're a bit late in schedule. So, but you could stretch wherever you are, stretch, take a minute, breathe, stretch, breathe in, breathe out, and we can continue. I'm hoping that everybody is stretching. You can stand up, you can sit down. You can take your water if you have water around as we take the next 1 minute or so to continue. I'll take my water as well. Great. I think 1 minute is over. So we turn to the other objectives of this workshop. And it's looking at, I hope everybody is back, everybody has stretched, taken some water, done your breathing in, breathing out exercise, and we are ready to go. So how medical students can engage in the public policy process to improve health equity around the world. I think we have mentioned some of this, but I will allow us to go through some. And kindly, you can chat, you can include something I've left out or something you think is important. Let's interact on the chat. So I before we touch on that, I wanted for us to just pause a minute and even ask ourselves, why should we care? Like, why should we engage in policy advocacy? For why does it matter to us? So one, I think we should know that politicians and governments, you don't always you go to office with the interest of the general public or with the interest of all of us. They go to the offices that they have with their own interests. And therefore, we must get engaged, because if we don't get engaged, definitely they will go on with their own interests and the community will suffer. So we have to influence decision making or decision makers, because the decisions that the political offices make, they affect our lives each and every day. If they are passing a budget and they are raising the prices of food that you need every day as a basic need, it will affect you in your house. It will affect you in your home. So as young people, as people of interest, with interest for the common good of the people and the communities, we must engage. We cannot run away from engaging in policy, engaging in advocacy. The other things is that for us, we have to promote an informed, healthy, and strong democratic society. It's a democratic space. It's a right for you to engage in policy. It's a right for you to know what the policymakers have, what they're bringing on the table when they go to the office. And so, especially in Kenya, we are about to go into an election in about a year's time. So some of these things we need to check. What are the promises? What is this person bringing to the office? We must increase our voice and action. Increasing the voice is calling out the policies that do not work for the community, calling out the things that are ailing the community. For example, the lack of financing in some aspects. And now I would even say you're training to be healthcare workers. You can see how healthcare workers have been treated in the past by the government. It's the issue of promotion, it's the issue of deployment, it's the issue of their salaries being delayed, it's the issue of how they're handled. Now it's the issue of they're not being given protective personal equipment, PPE. So to speak, the government is not caring about their frontline workers. So those are the things that you, as advocates, continuously, you have to put your voice to it. You have to influence the money allocation, because these directly affect what you find when you go to the hospital. Is there enough drugs? Is there enough diagnostic kits? Is there enough even supplies? You can have a drug in a vial, but not have the injection, the syringe, for example. So how are you going to be able to manage patients in a hospital that has no, surgical gloves, for example, and you need to do some minor operations and some procedures that require you protected or requires the wearing of surgical masks and surgical gloves. So we must be able to influence the money allocation. What goes to the health docket is very critical for anybody working in health, because it determines whether people are going to find health services being delivered or not. And also mitigate risks to our community. For example, some neglected areas in our government implementation is the prevention. So we are a sick society. We prioritize money for the sick, we are building the best cancer hospitals, cancer equipment and all that. But how about being at the community level, prioritizing prevention of, cancer, prevention of all these preventable illnesses that we see. Prevention of what? I would say cancer is now the most, requires a lot of, we're always seeing people fundraising, people selling off their property. Yet in a UHC dispensation, we are saying nobody should be pushed further into poverty because of wanting to access health. But this is not true. Every day you find a WhatsApp group being created for people to make contributions, for somebody to go to India and get treatment and all that. So how do we mitigate that people are not going to India? Is by improving how, health promotion is done and health prevention is done. Perhaps this person who needs a surgery today, 10 years, they probably had something that if they would have walked to a facility at a community level, it would have been detected and would have been solved at that level. But because we are not promoting health and we are not making people aware of the signs that they should see and go to seek health, because that is not funded, that is not prioritized within the policies that are implementing that at the county level, at the village level. So it then becomes this huge thing that now needs to go to India, needs millions of shillings of money to be treated. So this is why we should engage. This is why we should call for health promotion, prevention. This is why children should be immunized, and we should ensure that we have vaccines at the facility level. And some of these things might sound good, but there are places you go and find there are no vaccines. Some places there might be vaccines, but the fridge where the vaccines are kept is broken down. Therefore, we no longer even know if that's a vaccine or not, because it's not being kept in the required cold chain that needs to be done for a vaccine. So this is why we should get involved. This is why we must influence. We must do advocacy. We must engage in policy to ensure that some of these things are mitigated, and that we have a healthier community rather than a sick community that now needs specialized equipment, needs specialized treatment, needs specialized everything. Before we get to specialized, can we take care of business at the community level for prevention, so that people then don't translate into being sick? Increasing efficiency and transparency, yes, and we need the media to help us to do this. So working with media is very critical in every way. So I want to briefly describe. So engaging, let me speak about a classical example of something we did when we were during the last elections. As civil society advocates in Kenya, we developed a manifesto, a civil society manifesto for every politician who was going to the office. And that said, alongside the manifesto that you are creating, because every politician must show what they are coming to bring, what their aspirations are, what their vision is for either your constituency, for either as an MP, member of parliament, or whatever office, including the presidency. So we had this civil society manifesto that politicians had to sign to. And they're signing to, this is us as community. We are asking you, when you go to the office, you must deliver this. And we had that, and we took it round. We had it signed by Jubilee, we had signed it by ODM, we had it signed by all these members of parliament. Perhaps we haven't gone back to ask them how far, or to measure, do monitoring evaluation of how much they promised and they did. But just by that action of saying we have our own manifesto as community, so if we are going to elect you to an office, you must give us this, and we had a list of the things that we are asking the politicians to give when they get to the office. So some of those things then helps you to hold people in account when they get to the office. That is real-time advocacy, because they will remember that they signed on something, and they will keep, if they want to come back, they will keep checking on it. However, maybe not implemented in full, but at the beginning, when they're desperate to get that position or to get that office, it's a good thing to engage and ask them, what will you change? And can you actually sign and commit yourself that you're going to deliver on this? So I wanted to give that as an example in Kenya, and other countries have replicated it whenever they're having elections. Other countries have borrowed that. I think Uganda did it. I think we actually borrowed from Uganda, and then Kenya did it, and other countries have done it. Some countries are easier to do. There are some countries you're not able to take up such, because the civic space then has shrunk and it's reduced. But we have a good country where the democratic space allows for that. So as we go into the next election, perhaps as young people, good way to ask yourself, what can we ask the leaders when they come to the office, and when they're coming to us, they need our votes? What is it as young people in this country that we are asking them they must do, they must implement, something that favors young people? And especially the area of sexual reproductive health. It's really an area that has been neglected. It's causing havoc in this country. We are having 275, I think it's now 288 adolescent girls and young women getting infected with HIV every week. 288 every week. That report was released on World AIDS Day. Here in Kenya, it is unbelievable. So we need to do an action, and especially speaking to you as young people who are in the medical field. there's something that we need to change. We are not protecting our young girls. The schools have been a safe space for young girls to stay in. As soon as girls are in the community, it looks like there's something, a dynamic that's changing and exposing young girls to HIV infection, which is really not good at all. So I wanted to speak a bit about what you can find here in Kenya. There is how you can engage in different ways. So there is a grassroots movement, and this grassroots movement is almost in every county. So what happens is that in every county, people come together. You have to have an interest in influencing policy and influencing doing advocacy. So we have people who come together. And these are people who, like yourselves, young people, and also people who have been with this community but have moved out of the community. They could be an engineer somewhere, they could be an accountant somewhere, they are working. So they come together to talk about their grassroots or their village requirements. What does this place need? So it's it's health. So for example, they would say, maybe we don't have, maybe this issue of young girls and adolescents in this community, they are getting affected. So they will try and get a solution for that. And then they will engage the county government, they'll engage the local leaders, they will engage the chief, they'll engage the girls themselves, they'll engage the church leaders, everybody who is concerned. So there's a grassroots movement. I think it's in every county. It's not under our leadership, but we could link you if anybody is interested in that. It's very effective because they do all kinds of advocacy in every style. They walk, they march to the governor's office, they march to their county assembly, they march everywhere to make sure that this issue that they have agreed it's an issue that's affecting their community is addressed. And also it helps within the budget making process because they identify what is our, for this financial year, what projects we want to do or what health projects we want to improve within our community. Then they push that through the county assembly, through the budget making process. When they do the interactions, the public hearing, they make sure that they are pushing for certain causes that they have identified. And later when the budget is out, they make sure the budget is somewhere in a public notice board so that everybody can see that this is the budget, these are the agreed projects that are going to be done for this financial year. And so everybody, for example, if a community identified they want 5 boreholes dug, so they will advocate, they will make sure that during the budget making process, 5 boreholes have been prioritized and they've been allocated in the budget. So when the budget is out, they will put it in a public notice board. It can be a public notice board in a school, in one of the schools within the community, so that they can keep track of where is the first borehole has been done, the second one, the third one before the year. If they see there's nothing happening and the year is running out, then they have a cause to go to their leaders and hold them to account to say, we have money for 5 boreholes, but we're only seeing 2. What is happening to the other one? So ideally, that's how the grassroots movements, advocacy movements should run. So we have these other ones. I don't know if I can't go through each one of them, but these other ones are, some of them are global, some of them are regional, but it's because the meetings are virtually. If you're interested in any one of these, I'm sure as I was talking, you are coming through them. So if you're interested in any one of them, feel free to ask us to link you up. So because of time, I'll not go through them, but because you have this presentation, we can always send more information. But I just wanted to say that this is, there's a lot of organizing for different networks to do different things. So for example, the CISPA is a civil society platform on health in Africa. That one, Waki Health is the host. It deals with all issues in Africa around health and brings together communities and brings together civil society. And civil society is like your NGOs, your CBOs, your people, advocates working for health around Africa. But we have some very specific ones like the AFNI, Africa Free of New HIV Infections, is a platform that Waki Health hosts. It's Africa-wide, and it just specifically looks at the issue of new HIV infection, how we can eradicate new HIV infections in Africa. So this is just, I think, the few that I selected. There there's a list, there is thousands of organizing or networks that exist that young people can plug in. So I will move to the third section of the objectives, how to develop policy advocacy strategies. And I need help now to break out into different groups, but after this slide. So we'll do a short exercise after this. And this is a process flow of how an advocacy strategy should be formulated. And that's why I did not answer the question that was asking how to formulate policies, because I knew we would come into this. So the first thing that you do, you identify what the problem is. Once you know the problem, what the problem is, you create a goal. You say, based on this problem, it has to be a health, we're talking about health, so it must be a health problem. So this is the problem, this is what we want, that is your goal. Then you do your objectives, and then you do your rationale for advocacy. Who are you targeting? Who are you targeting with this, like your advocacy? You do power analysis to say who is involved in this, in hierarchy of power, who can solve this problem that we have. So you track down that the people who can solve your problem. Is usually not one person, it's probably a series of people that you will engage. You look at allies, opponents working in coalition. So you're looking at who is the best person who can help us here. Who are your opponents? Who are the people who say we cannot allow this? I think there was an issue of the religious community. Some may not agree fully with some health projects that we implement. So if those are likely to be the opponents that you have, what do you need to reach them with that? Then you have, of course, to organize your key messaging. I'm telling you some of these things, they sound so easy, but when it comes to a project implementation, these things can take you quite a while for you to define this. And the key and the messaging is also something that will take you quite a while for you to come up with the exact messaging of what you want, and what what you want from the goal that you're seeking, or the health goal that you're seeking. If you think about the one we use for HIV, for PrEP, it says dependent PrEP, like love yourself, prep yourself. I want to believe that you're conversant with PrEP and what PrEP is. I know you are, because you're in the medical field. Yeah, so dependent PrEP. I'm sure before these people came up with that slogan of dependent PrEP, there were like 100 slogans until they arrived at this one. So key messaging is very, very important, because if you mess with the key messaging, then everything else falls. You look at your tools, your actions. What are you going to do? So you have to engage yourself in some research, searching around what perhaps other people have done. If they had the same problem, what have they done? Policy development, sometimes you can call it lobbying. So you need to go to the people who develop policy, either do a policy analysis, check whether that is taken care of within the existing policy. If it's not taken care of within the existing policy, you have to ensure that you lobby for an update of the policy, because we said anything outside the policy will not be implemented. It has to be, it's the policies are the Bible of what people implement. So if what you're seeking is not captured within the policy, you have to really go around updating the policy or creating a new policy around that issue. You're not going to do it that you're only an advocate, or you're just wanting to see a change, but unfortunately for you to see the change, you have to engage yourself in a process flow to the end game of what you're looking for. You have to do media. We can't overemphasize media because of transparency, because it brings you everybody. Like if the media station announces something, it reaches a large number of people, brings the traction of people and interest of people. You have to mobilize. You can't do just alone. You have to have a critical mass. You've seen all the networks. Those networks have thousands of people, hundreds of people in them. Because when you want to mobilize or change a policy, the government has to see that it actually really means a lot for a lot of people. Like a lot of people are affected in the issue, because they will not change a policy because of a small population or a group of people. It has to show that a large population is affected and the impact that that might have within a community. Then you look for, of course, funding. If it involves funding, it will require money. It can be a big problem, it can be a small problem. So in the process flow, you'll determine, if I need funding, what level of funding is this I'm looking for. Then there are opportunities and events. These are, for example, there's a meeting where the governor is coming to ask for votes, or there is a member of parliament who is coming to your community to ask for votes, or to your school, or whatever it is. You need to map those and be able to use them as your own opportunities for doing a policy intervention. So there is a human and financial resources. How much time do all of you who are working on this issue have to go and meet people in the office, to go travel? Sometimes if you're in the county level, not in Nairobi, the policymakers are in Nairobi. There's a financial implication in you moving from one place to another for those kind of meetings. Or if you're bringing people together, then you need to find the people. You need perhaps to facilitate the people to come to you. Then you look at the risk management of what you're trying to do, and you have to keep monitoring and evaluating whether you will get the results. So we want to do, based on this, I want you to break into groups. When you break into groups, I would like we take 15 minutes for us to do this exercise. So this, you have seen the process flow. I'll leave it on the screen as you do your breakout. I don't know if you will see I don't know if you'll be able to see, but you can take a screenshot as you go into your groups. So this is the scenario. So in your community, there is an outbreak of TB cases. There's only one health facility in your area, and there's one nurse who has recently taken a bereavement leave. You will develop an advocacy strategy as a community leader. So in your group, you're the community leaders. You go through that process and come up with a very brief highlight of how you can address this problem. In the first place, you need to identify what is the problem here. And then you go with the process flow and give us an intervention that you can do for this situation. So Cheryl, if you can help us with the breakout discussion, I think they can take 15 minutes, and I think I'm ready for the breakout.
How many rooms do we create?
How many are we? We are 9, eh? Can we do three people?
Okay.
Yeah, I don't mind to go into our one group. So 9, 3, 3. Yeah.
Okay.
Or maybe 2 groups. Yeah. We can do 4, 4. We can do 2
Oh,
groups.
2. Okay.
Yeah. We can do 2 groups.
In that case.
Yeah. One with 4 and the other one with 5.
Okay, let's
Yeah.
Let's try again. I'd already create. Let me delete this one.
Okay. Yeah, hello everyone. Welcome back from the breakout groups. If you could just take a second and chat how the exercise was. How was that exercise? Have you finished? If I get one or two responses, I'll be able to proceed. But just wanted to hear from your perspective how the exercise was. So I have one response. I'm waiting for the final. So there's a lot of information to be covered. There's wonderful, there's interesting. So I would like to challenge you all to actually finish that exercise after your annual conference or when we have time. I'm sure you know one another. Could you actually do it and come up with a solution? So because of time, we will not go through the answers. We'll not have a time for plenary as planned. But I think that's a very brief sneak preview of what we go through as advocates, because every problem, every challenge you identify within the community or within the work circles, you have to go through that process and you have to refine before you're meeting a policy maker, before you're meeting heads of state. Sometimes we do meet heads of state. We do meet ministers of health. Before you go to a minister of health, to a heads of state meeting, you must go with your key ask. You must go with your key talk point, and most of it, you're given 5 minutes to do an intervention. So you can imagine the time that it takes to plan, so that in 5 minutes you can present all that. If we had time, we would have done one group presentation, but we don't have that time. So, but in your responses, and I am kindly asking that you do that project, find time and do that project. But in your responses, I'm expecting that you've identified some problems. Just check whether you identified as problems as an outbreak of TB is a big problem, because TB is a public health threat, worse than COVID, because it is spread through air. I'm sure you know that. So TB outbreak is quite huge. TB is killing more people than actually COVID is killing. But anyway, TB has never gotten the highlight that it deserves as a pandemic, as a killer disease that's killing so many people every day. So there is a huge, if you have in a population an outbreak of TB, is a huge public health threat that all the health people should be alert to come and actually take care of that. So it's a serious public health outbreak, epidemic. It's a threat. This community has only one facility. That's just enough problem. Like, one facility is in a community is problem. So that should have been the other problem that you have on your list. The other problem is one nurse, one healthcare worker can never exhaust all the problems of a community. That's a big problem that deserves a whole planning, how the next budget you prioritize to increase healthcare workers for that facility. So in your advocacy asks or agenda or priorities should be to increase health facilities in that area, should be to control the outbreak of TB, should be to increase the healthcare workforce in that area. So just check whether you have those or if you are able to articulate that. The other issue is that there should be health promotion prioritized within that area, because TB in itself, an outbreak shows no health promotion. I mean, there's a serious need for health promotion within that community to check the ventilation and all the TB prevention measures. There must be an engagement with the budget holders, the county government. Those are your power people, or who the policy makers or decision makers must be engaged. One, to increase facilities, increase healthcare workers, control the outbreak of TB. And that must be prioritized within the next budget. Within the next budget, those must be done, because you cannot get a facility built when there's no money. So that should be a priority for the next budget cycle, that the community must ensure it is factored and prioritized within the next budget cycle. Then you need to look for other people, for example, NGOs, organizations that work on TB, that can come and respond by bringing healthcare workers on site as soon as possible and ensuring that there are people who are responding. We also do have community health workers. They should be put to task to distribute information materials to the community, that how to prevent themselves from acquiring TB from the outbreak. So there's a lot that needs to be done for that community. So you needed to take all the problems, list all the problems. Then with each of the problem, you needed to go through the cycle of formulating an advocacy strategy for each one of them. Adding healthcare workers, deserves a strategy on its own. Adding facility requires a strategy on its own. Controlling the outbreak of TB, a strategy on its own. Information packaging and all that requires strategy, an advocacy strategy on its own, and so does the budget advocacy. So there's an issue with budget advocacy. Where is the money meant for that constituents or that place going? That money in the next cycle, the community must define that it must go towards improving health access within the area. So the budget allocation should be another one problem that deserves another strategy on its own. So you can see a small problem, but if you need to tackle, you need to each one of the problems develop a strategy, an advocacy strategy for each of those problems. Some of them are interrelated, but they each need to go through the cycle and have their own advocacy objective. So not quite easy to do that. I mean, you said it's wonderful, it's interesting. You said there's a lot that needs to be covered. I do agree. The process is tedious before you can get to the actual ask, because at the end of the day, you just need to go with actual ask to a policymakers who perhaps gives you 2 minutes to state what your problem is. You will not start giving their stories. You will have your key ask. We want 3 facilities in this location. We want 5 facilities. We want 10 healthcare workers. But before you arrive at 10, how did you arrive at 10? And how will those 10 health workers get to you? If you go to the politician, they will say yes. If the budget is not relating to that, if the budget is not speaking to 5, they will never come. Yet the politician said yes. So that's why we need to differentiate also, political rallies where people just go and make commitments, and those commitments are not put in the budget, are not put in a policy. They will never be done. And that is why politicians come, they make promises, and then they run away and nothing. 5 years later, you're asking them, they could not, because you have to ensure that if this is a true need within the community, it has to be within the budget of that community. It has to be in a policy somewhere. If it's not documented, if it's not budgeted for, it will not be done, regardless of whether whoever is telling you that we will do that in a political rally or in a meeting or whatever. So that's the essence of advocacy, to make sure if a politician or a leader has promised something for the community, you have to check the budget and influence that that thing is added in the next funding cycle so that it can be realized. So that's what I wanted. Let me just share just 2 more slides, and then we'll be done for this session. If there are quick questions, I can take them, but let me just finish on the assessment. So we can come to ask questions, and we'll share this presentation. But I wanted to say, what are some of your advocacy tools? So your advocacy tools, media is very, very, very effective. Ensure that there's always transparency. Media does that very well. You can write a policy letter or statement. Sometimes you have the open statement to so and so, but a letter, you can write letters to the leaders or policy makers indicating what you need as a community or what you want that change. We write a lot of letters for this. So a classic example, in 2018, we were doing a campaign to advocate for countries to step up the fight for Global Fund. That's for TB, HIV, and malaria. And we were asking globally that we raise 15 billion US dollars for Global Fund. And during this time, we did a lot of letters, and the letters were going to each countries. We were taking the letters to the embassies, just to the embassy, to the high commissioners in the embassies, to ask them for their countries to pledge money for Global Fund, 15 billion US dollars. So letter writing to heads of state, to your governor, to your member of parliament, if it can be signed by a critical number of people, then it's even more effective if the letter has signatures from the community. Sometimes when things are so bad, for example, our TB outbreak, if nothing is being done, you can do a press conference. Press conference is what you call media, and then you come and air your issues. I'm sure we are quite familiar with this, with elections and all that, but also for advocates and for young people and for people who are working in areas that they're passionate about and they feel that they're not being heard. You can call the media and do a press conference. We have done press conferences over many things. For example, there was a facility for TB facility in Isiolo County, where there was controversy around the TB facility being converted into county offices. So as advocates, this was very unfortunate because TB kills more than any other disease, and it's something that if patients have been collecting their medication from one center, you need not to disturb those patients, because if they come and are not able to access the treatment, it means when they go back to the community, you can have a real outbreak of TB within community. So the press conference was then held to actually tell the county government that you cannot touch a TB manyata or a TB treatment site for county offices, and that was effective because the TB site was not shifted. I think this was in 2016. So sometimes when things are so pressing and when things need to be done, you need to do what you need to do to raise your voice. Then of course, you can do march, peaceful demonstrations and protests. This is where you take placards and with key messages. I remember for the TB site in Isiolo, we did that. We did messages on our placards and said, you cannot touch. And we said, the county government, you want to kill us. Because if we can't have a place to access a TB medication, it's equivalent to you're killing us. So you can have those kind of protests just so that your voice is heard. And allies building. Allies building is, having your own informers when it comes to the policies that are being developed, the kind of funding. Somebody would tell you, by the way, there's a policy that's coming, and I don't think it's very supportive of communities, or communities have not been allocated money. So when you have that allies, they sort of give you that information. You're able to take that information and do the necessary action that you need to do and raise your voice. Then we do have policy championing, or you can have a few policymakers who are your champions who will run for your cause. So if it's TB, for example, who speaks for TB? We know a popular song by Yvonne Chaka Chaka, the South African musician, that sings and says, no, it's malaria, that we need to stop malaria. So you can get a champion who can make songs, who can speak in perhaps a heads of state conference, a minister's meeting, or a governor's meeting. You look for one governor who is very passionate about the issue you want, and you can speak to them, and they can become a champion for that cause, and they can speak, because the voices of politicians and the voices of policymakers are quite powerful, and can bring policy change that you're looking for. So I just wanted, this is, I think, my last slide. I wanted to highlight, because you're in the medical field, you're in health, some of the areas that are really critical for your advocacy and where we have gaps, or areas that are really, really critical for you to engage when it comes to advocacy. So there's the health R&D, that's the health research and development. The whole issue of scientist, conduct of research, conduct of clinical trials, that's an area that African doctors like yourself, African professionals who are in the medical field, really need to focus on. Most of our drugs and the science we get is externally driven. The research is externally driven. Most of our facilities here in Africa and in Kenya are not so equipped. For example, we have the COVID-19. We could not produce a vaccine as Kenya. I think we were doing some studies, and those studies are externally supervised, externally, planned. So when they come to African countries, we just have to follow a script that has been drawn from, the US and the like. So calling scientists a lot in this area, and also to promote the ethical conduct of research. If it's homegrown, we know about our values, we know about our traditions. So if you are designing research in Africa, then it's an African, it has the African values. We know how we treat different things. So if it's externally designed, it's not really designed for us as Africans, but so we need to be able to design our own research. So there is also advocacy for more research, more studies to be done, especially around HIV vaccine, HIV cure, HIV treatment. There are still a lot of gaps around there, but we have made such progress, but there could be something. I mean, we really need products that are multi-purpose, that can take care of perhaps prevent you from pregnancy, from HIV, from STIs, all that. So we need new drugs and new tools. Some of the drugs we've been using are very old. They were being used in the 1960s and 70s. We still don't have new drugs. So need for research, need for new tools that can work for us in this day and age. So also funding for health. You have seen what COVID-19 has done to our health systems. COVID-19 has crushed the health system because everything stopped. so that we could focus on COVID-19. So we need to ensure that there is strong health systems, that we have domestic funding for our health, because when we had the crisis, COVID-19, we had to go external to look for funds for COVID-19. Before you can negotiate, before you can get the assistance that you're looking for, the funds that you're looking for, already people were contracting COVID-19, and we didn't know what to do without the extra support. So asking that the African government, Kenyan government, to strengthen health systems such that if we get any other pandemic, the system is able to take care of its people or the citizens. So a lot of also work needs to be done on advocacy around UHC, that's universal health coverage and primary health care, TB, HIV, and malaria, maternal health, adolescents, and child health are all areas that are really needing voices. They are needing advocacy, because there are areas that we are not doing well and our health systems are weak. So we need to, and this is the backbone of the health, especially preventive care, the TB, HIV, malaria, maternal health. Those are primary health care services that can be done better than what we have right now. So I wanted to say that even as you're in school, as young people, that you can do a change. You can bring a policy change if you purpose. And I love this quote that says, "Never doubt that a small group of thoughtful, committed citizens can change the world." And indeed, it is the only thing that ever has. I will end my presentation with that, but I will take maybe 2 questions and then hand it over back to Cheryl to close this meeting. Thank you so much.
Thank you so much, Joyce, for that amazing presentation. I have personally learned a lot. So yes, as Joyce mentioned, we're taking a few questions. So kindly ask in the chat box or just unmute and ask your question. Anyone? A suggestion, a remark? Yes, Oyeho?
Everybody is Oyeho. I have more of a remark than a question, comment. I wanted to say that I've really learned a lot. I've learned a better way on how to strategize on when you're coming up with a policy. And I would like to say thank you very much.
Thank you, Oyeho, for the comment. Joyce, I hope you heard that. Okay.
Yes.
Okay. Anyone else? Okay. If there's no other comment or question, I think we can end the meeting there. And so thank you all for joining us today. It's been a pleasure to interacting with you and discussing such vital topics. And I'd just like Joyce to say anything else before we end the meeting. Cheryl? she has something to say.
Yeah, yes. So on behalf of Waki Health, thank you so much for inviting us for this platform. I've enjoyed the interaction with you. Thank you so much for using the chat function, for all the questions, the comments. Thank you for engaging. I hope we have made the last presentation useful information for you all, your young people. We encourage you to take up the space of policy advocacy. Is very, very important, and especially because you're coming out of school to going towards health sector. So there's a lot in health sector that you can help to advocate, you can help to shape the health agenda of this country. And therefore, I'm calling on you not to sleep, to get engaged and help us shape the health agenda of this nation as young people. The future is in your hands. You can do it. So thank you so much. From Waki Health, that's all. And I'm wishing you all the best. COVID-19 is still here with us. So again, just asking all of us to be careful, to protect ourselves, and to also encourage those who have lost a loved one or have someone who is going through COVID-19, our prayers and best wishes. So thank you so much, Cheryl, for this opportunity. We are grateful and we appreciate. Thank you so much. Do not miss a presentation from our boss, Rosemary Mboro. I think she'll be making a presentation again with you. I'm inviting you all to listen to her because she's a great African woman leader. So thank you so much.
Thank you so much, Joyce, for those remarks. And once again, I would really like to thank you all for being lively and participating actively in the session. And yeah, we hope to see you in the subsequent sessions. There is a panel session tomorrow on pandemic preparedness. And on Monday, we have Youth and Health, where Rosemary will be, who's the Executive Director of Waki Health, will be speaking. And I am sure you will benefit a lot from that session. So I urge you all to keep attending the sessions because, as you can see, they're very educative. And yeah, you will come out of the a better medical or healthcare student. Yes. With that, I would like to close the meeting, unless someone would like to say something. And so if not, have a lovely rest of the week, the weekend, and let's see you in the subsequent sessions. Thank you. Bye-bye.